Well, good morning, everyone. And once again, welcome to another live this morning. And guess what, guys? It's Q&A. Q&A. And let's see, as you get your notifications, thanks for coming on. Here we go. We got some people I know have got their notifications. So is anyone going to say hello this morning? I think so. Who will be number one? That's the key. Janice. On mine, from Brampton, Rosalinda, Andrea, both of you from Niagara Falls, Nellie, Brahim, Portland, Oregon, Judy, New Brunswick, good morning to you. Hi, Lisa, good morning. Roxanne, we love having you on. Sandy from Fergus Falls, Minnesota. Georgie, Halifax, Nova Scotia. Hi, Sue. Manitoulin Island. Lily, how are you from Cochrane? And Mary, saying hi to Dave and Helga. Sharon from beautiful Kansas. Lucille from mid-May. No, mild May, is it? Yvonne, Petawawa. Mary from Gander, Newfoundland. Donna from Newfoundland. Grace from Newfoundland. Holy smokes. Sandy, Chilliwack, British Columbia. And Bonnie in Little Britain. Christine, Fort Worth, Texas. Nicole's on with us this morning. Sue. Gary. Kathy from Simcoe, Ontario. Heather, Miramichi. Teresa, Mississauga. Bonnie, Blenheim. Carol, West Virginia. Hi, Gwen from Alberta. Karen from Coldwater. And Diane, good morning, Diane. And Judy, to the mayor, saying hi to Kevin. Kevin was in the clouds. Hi, Doris from Kitchener this morning. Cheryl, West Virginia. Maureen from Boca. And Karen from Peterborough. Catherine from Springdale, Newfoundland. Hi, Millica. Sandy in Vancouver, Washington. Francis from Vaughan. You guys are wonderful. Nativity saying me. Nativity, I don't know how I miss you, but I do. Diane, Mary, Kristen, Saskatchewan. Norma from Texas. So Texas is well represented. You get bonjour. Fran was in the clouds today. Fran, I have no idea why. Kathy. Port Perry. Hi, Rita from New Brunswick. Paul, there he is from Edmonton, Alberta. Dennis from Norwich. Kristen saying hi to Cindy. Laurie from Cambridge. Marilyn from Charlottetown. Guys, we love you. And Elsie, how is you? And Gary from sunny Bolton. Well, it's not sunny where I am. Okay. Let me see here. 10 minutes. Let's get to our questions this morning. Thomas, you're trying to catch me, aren't you? Because Thomas, I love these questions, okay? And I want you to question me. Because you're asking something. I like it. You know what Thomas is asking? Dr. Martin, you tell us. We're not squirrels. We're not chipmunks. Why are you eating, don't eat seeds or nuts? And I didn't say don't ever eat them. I'm just saying, yeah, they're overrated. But then you tell us flax seeds. And one of the reasons you tell us to cut out seeds is because what it does to your digestive tract. It irritates it. You got a sunburn? Don't rub it. If your gut is inflamed, fiber and seeds and nuts will irritate it. But Dr. Martin, then you tell us to Take flax seeds. I love that. Thomas, you're thinking. And it's a good question. Well, here's me. Flax seeds are different than anything else, and the reason is because they've got 100 times more lignans than any other seed. And lignans, 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 I think that's how you say it, they block xenoestrogens. They block extra estrogen. That's why I love them. They're different. And that's why even on the reset, I tell people, you know what? You can have a tablespoon or so of flax seeds every day, just blocks the extra estrogen. You and I, Thomas, we live in a world where almost everything mimics estrogen. They're called xenoestrogens. The air fresheners, the fragrances, the microplastics, and all these things, they elevate estrogen. We got enough estrogen. A man don't need estrogen. And a woman, you got enough of it. Okay? And so flax seeds, that's why I like them, Thomas. So if you got diverticulitis or diverticulosis, yeah, you probably better not have the flax seeds and just take DIM as a supplement. Okay? DIM is DIM. And that blocks the extra estrogen. You know, I love that. It's in our menopausal formula. Okay? I love DIM. I've proven it to tens of thousands of women over the years, how that blocks their extra. Guys, ladies, you need estrogen. But it's these xenoestrogens that you want to block because they're very cancer causing. Estrogen and insulin are growth hormones. So Thomas, that's why I said it. And if you have issues with your gut, well then don't even have flax seeds. Okay? Thank you. You're thinking, Thomas. I love it. Okay. I listened to your recent podcast. This is Daniela on the triglyceride fasting glucose to see if your kidneys are functioning well. Yeah, okay, so you take your triglycerides. You know how much I love looking at triglycerides. When it comes to your lipid profile, look at your triglycerides. Okay? Really important. And you know what I love in that equation? Your triglycerides and your HDL, because that tells you a lot. Okay? Now this is sort of new thinking. And okay, and Daniela is asking about the triglyceride fasting glucose test. Okay? Because it's a real good indicator. Like if you Google it, it's a real good indicator of where you're headed in terms of diabetes and insulin. And insulin resistance is a good marker. I like the cheap man's version, I call it that, of A1C, okay, which is glycated hemoglobin. But Daniela, yes, I talked about it because there was a new study and it talked about that, the importance of that for your kidney function. It really does give you a good indicator. And so I looked up my blood test and my triglycerides. You got good triglycerides. Your fasting glucose is 5.5, which is very good. Are you misunderstanding the formula? I wait a minute. How did you do it? I can't even remember exactly what is it. Is it times 2? I got to look it up. I can't even remember. It's so new. Okay? I brought it to you because there was a new study on it. And, but your calculation would be good, Daniela. Okay? I think you miscalculated. Let me go, Daniela, if you don't mind, send me an email. And I will, at info@martinclinic.com. It'll come to me. And I'll go over that formula with you. I got to look it up again because I can't remember exactly if it was times 2. Somebody here remember what I said on this study? Because I never used that formula. Okay? I really didn't. I'm a big guy on A1C. Look, I like, if you want to do fasting glucose and this and that, I got no problem with that. And fasting insulin, I have no trouble with that. I like to keep it simple, and I really like the A1C. Okay? And generally, it's easy to get your A1C done. So fasting glucose, this is a new formula. Triglycerides, fasting glucose, is it times 2? I can't remember. Anyway, I need to give you a better answer. Thanks, Daniela. I love it. You're listening to the podcast. Love it. Bruce, does Dr. Martin agree with taking Amla with rheumatoid arthritis? Well, I'll tell you what I know about Amla, Bruce. Not much. Out of all the years I've been in practice, what? Almost 50? Amla. AMLA. It's an oil, isn't it? I don't even know if you take it internally. Anybody here want to pontificate on Amla? I don't know what to tell you, Bruce. Does Dr. Martin agree with taking Amla to help with rheumatoid arthritis? I've never heard that it's good for that, particularly. I'm learning stuff this morning. Okay? Anybody used Amla on our scroll today? Know what Bruce is asking? I hate to give him a bad answer, but when I don't really have any experience with Amla, I don't know what to tell Bruce. What do you guys suggest? Any of you that have tried it, okay? Any of you that have tried it. I don't know. I can't remember ever a patient, and I'm not kidding you, that even ever talked to me about that oil. I don't know. I can't remember. Okay? So it's not that Diane says, I just ordered some Amla. Etta says, I never heard of it. Well, I heard of it, but I can't say I had anybody tell me with rheumatoid arthritis if it's any good. I don't know. I would tell you things that I would have people on rheumatoid arthritis be way ahead of Amla for me, in my experience. Okay? Remember, it's autoimmune, so you got leaky gut. I do that. Very inflammatory, anti-inflammatory diet. Like lay off the sugars and the crappy carbohydrates. I love curcumin for, and a combination of curcumin and Navitol, okay, for anything on the exterior, rubbing into joints that gave you much relief in rheumatoid. I don't know. I thank you very much, Bruce, but I'm sorry I couldn't give you a better answer. Teresa says she'll report back. Yeah, and Lee says, I have rheumatoid and I'd like to know. Yeah, but I look at guys, if I have not heard that in 50 years of practice, and it was the greatest thing since sliced bread, you know what I mean by that expression. Somebody gave me, so people are sensitive. So I said, it's the greatest thing since sliced bread. That was an expression my mother used. It was an expression I heard when I was a kid, and I'm repeating it. Don't get too uptight. I know what it says, Carol, about amla, okay? That it's good for your hair and all that. I just have no experience with it, and I've been around for a long time, okay? But if you guys do, you tell us. Okay. Okay, that was Bruce. Della. I ended up with my vision doing a weird thing last night, okay? And then they found out as she went to an ophthalmologist, said you had a little mini stroke in the back of my eye. Okay? Other than sending me for blood work and a carotid test, he said he couldn't do much. My vision is pretty crappy in that eye now. Well, look, I mean, here's me and eyes and circulation. No sugar, okay? Della, no sugar. Sugar destroys blood vessels. No sugar. Food, no sugar. I'm big on DHA and Navitol, pine bark extract for the eye. I'd have you on that. I'd have you on, if you've had a stroke in there and behind the eye, I'd have you on 6 DHA. If you were in my office, in the old days, you were in my office, I'd have you on 6 DHA and 6 Navitol for a month because you had a little stroke in the back of the eye, in a blood vessel. Okay? And that's what I would do. Regenerative. I tell you, I got tremendous results. I would have you on high dose for about a month. And then you can go on a maintenance dose. But that's what I would do, Della, because again, you know, there's other things that people recommend for the eyes. I never found anything better than pine bark extract and DHA oil. The best. Elaine, why is my stomach gurgling? Okay, hold on. Are frequently making noises. Though I take probiotic. Well, you might have, there's a lot of things that might be going on, Elaine. You know, I would need to know more history, like have you had a history of IBS? I'm very suspicious when I hear about that gurgling and whatever and your stomach. But is it really bothering you or is it just gurgling? Okay? A lot of times, too much fiber. Fiber is overrated. You know me, and I mean it. But you might have SIFO, small intestine fungus overgrowth. That can be a sign of that. Give me some more detail on how your gut is doing. Send it to info@martinclinic.com. Because, Elaine, I can't, even though you're doing the right thing, take probiotics. Absolutely. You might need digestive enzymes with every meal, too. Okay? Don't leave home without them. Digestive enzymes. So good for you. Okay. Patricia. Is there any truth that pork doesn't have sweat glands, that they retain toxins in their body? Then if this is true, we ingest toxin by eating pork meat. They don't have sweat glands and they don't sweat. I've never heard that. Okay? Look. Okay. I'm a Bible reader. Okay? And pork in the Old Testament was an unclean food. okay, today, I think Muslims don't eat pork. Correct me if I'm wrong, okay? But when you look at the nutritional value, okay, and Jesus, by the way, said all foods now, okay, are clean. Because the Jewish custom in the Old Testament, they had unclean foods. Pork was one of them, okay? But Jesus said, nah, he had to teach his disciples, know that, okay, we're not under the law anymore. And because Peter said, when he got a vision from heaven, I don't eat anything like that, Lord, unclean foods. He said, well, you're going to start. So, look, you look at the nutritional value of pork, okay? And by the way, I love pork, okay? The only thing I like better than pork is steak, but I love pork. I love bacon. You know me and bacon, okay? And I don't mean to offend my Muslim friends. I don't, okay? And if your religion calls for that, then okay. But when it comes to nutritional science, okay, because that's where I gotta tell you what the nutritional value is. Pork is very, very good for you. It's better than any vegetable or any fruit in terms of nutritional value, okay? Now make sure it's cooked right, okay? Doesn't have parasites or whatever. But I gotta tell you that bacon is better than any fruit you're gonna have for breakfast. Bacon is better than any bread you're gonna have, bagel, whatever you want to have for breakfast, it's better. Bacon is better than, well, yogurt's good. Bacon's better. Okay? So you want to have a pork chop? You got B12 in it. There's no vegetables got B12. So what am I going to tell you? Steak is better, but pork is good for you. Bacon has oleic acid. So does olive oil. I like bacon better than olive oil, even though I love olive oil. I do love olive oil. Olive oil is good for you. It's a healthy fat. So's bacon. Okay? So, there's me. Okay? There's me. Now, look, like I said, you have religious purposes. You have vegans, vegetarians. They're sort of semi-religious about their thinking. Hey, I respect them. I really do. I really do. But when it comes to nutritional value, that's what I focus in on. Okay? That's what I focus in on. The sweat glands, I've never heard that before. I just know pork's good for you. Okay, that was Patricia. Thank you very much. Penny, should I take B12 if my red blood count is high? Yeah, I'd still have you on B12. Look, your red blood count could be different things, okay, if it's high. I'm big on B12. You should be eating your B12. And a lot of people got to supplement with B12. What is your B12 number? Even though I don't only look at that, but I want B12 to be optimized in your body. If your red count is high, I wouldn't cut back on B12 if you feel good. I know that B12 helps in the production of red blood cells. For sure it does. Okay, so does iron. Eat steak. Chris, he's got dysglycemia. You know what Dysglycemia means could be high blood sugar, low blood sugar, fluctuating between the two. I used to see a lot of hypoglycemia in my practice with adrenal gland exhaustion. A lot of times they had hypoglycemia. But listen, dysglycemia, let me see, what are you asking? Okay, you got good A1C, that's good. You're 5.4. Fasting insulin is very good. He lives in the USA. Okay. He walks 2 miles 6 days a week. You're eating good. I wouldn't worry about that. Look, you got trouble, and so does Chris. Okay, and I think you're a woman. Okay, Christine, okay, I think. And by the way, you had I didn't know if you were Canadian or American. That's why I asked you to tell me about your vitamin D. Okay, so 200 in American numbers, it's higher than medicine likes. I'm not worried about 200 US numbers. I'm not. What is it going to do to you? You're not toxic. So, Chris, I wouldn't worry about that. Okay? So you got dysglycemia, and you and carbs don't get along. Because what goes up must come down. Right? A lot of people with hypoglycemia, low blood sugar, they don't want to be spiking their blood sugar too high because it'll come down too fast. And, you got both ends of the spectrum. I love your blood markers. Monitor those all the time. You seem to be doing real well. We all got weaknesses, Chris. That's your weakness. So what? Now you know you got to stay on the straight and narrow and eat good. You and crappy carbs, they don't get along. Pretend you're a diabetic. Dysglycemia. Pretend you're a diabetic. And treat yourself as such. You'll stay on the straight and narrow. You won't get off the road that leads to good health. Thank you for the question, Chris. Bonnie. Essential thrombocythemia. She's been diagnosed. What would you suggest? Well, Bonnie, a couple of things. Number one, people that get that, a lot of times they don't even have any symptoms. They don't even know they have it until they get a blood test and they find out that their platelets are high. If you're feeling good, Bonnie, eat good. I would tell you to just keep living, keep exercising, keep in good shape, keep eating low carb, and take care of yourself. Watch your numbers. You're going to be fine. Some people get that and they get a form of leukemia, blood cancer, but you might be a little bit more susceptible, Bonnie, but I wouldn't, now it just make sure you stay on the straight and narrow. Take care of yourself. Okay. Take the supplements you're taking. Vitamin D, keep it optimized. B12, keep it optimized. Probiotic. Lori, what can be done for a finger clicking? Well, do you have trigger finger? Because, you do this and your finger clicks. Do you have trigger finger, which is caused by glycation? It's called Dupuytren's contracture. Do you have a contracture? Like, is your finger, that's a trigger finger. But just clicking might be a precursor to that tendon getting calcified, getting glycated in your hand. Okay? Debbie, she drinks an average of 4 to 5, so 2 liters around 2 liters or 64 ounces of water a day. In February, she had COVID, didn't do well, got pneumonia, now has congestive heart failure, and on water pills to get rid of the fluid from my lungs and around my feet. Someone told me that water I was drinking is contributing to the fluid in your lungs. Look, you're drinking 2 liters of water a day, you need it, even with congestive heart failure, okay? And you got fluid around your heart, and they got you on meds, but you need water. And 2 liters not going to fill your lungs up with fluid, I can tell you that. Your body operates on water, okay? So I'm not too concerned about that. Make sure you are on with congestive heart failure. You're on ubiquinol, you're on DHA, and you're on Navitol. For sure, for sure, for sure. Okay. Brenda, my doctor discovered a slight heart murmur. Not too worried about it, apparently. At 65. What would cause that? Well, a couple of things. I always look at CoQ10. Might be low in that. You're not eating enough steak. Ubiquinol, okay? You might be low in B12, although you're telling me you're taking your B12, which is good, okay? She didn't take a statin. It can happen. Get a murmur. And if your doctor's not too worried about it, I wouldn't be too worried about it. If he doesn't think you have atrial fib, that's what I would do, Brenda. Take good care of yourself. Let me see. Can I get done here? I think so. Joanne, severe degenerative changes in the, where do you have it? Anterior labrum, supraspinatus tendon, tendinosis, AC joint. You got a bad shoulder. What do you think of cortisone shots? Well, look, it's a Band-Aid. Problem with cortisone, and it can be very effective. I mean, when you got inflammation and you get a cortisone shot, and it can be very dramatic. But, and there's a big but attached to it. Cortisone destroys tendons. Okay? So you gotta weigh the benefits, the side effects. You have to weigh that. Okay? You got a lot of inflammation, you're in a lot of pain, and a cortisone shot can be very effective. But, okay? And again, you got to understand that. I used to tell my patients, I'm going to give you both sides. Here's the benefits, here's the side effects. Okay? And you got to weigh that. Thanks, Joanne. Appreciate the question, Claudette. Oxygen levels are great, but I have a heart murmur. Well, again, Claudette, what does that mean? Well, again, as long as it's atrial fib, or if you got tachycardia or whatever, CoQ10, ubiquinol. Eat lots of steak. You should be on ubiquinol. Navitol, DHA, cardiovascular. Your heart's a muscle, CoQ10. Okay? A lot of times arrhythmias, murmurs. Your heart is an electrical grid. And what helps with that is, again, what I mentioned. So take care of all of that and eat a lot of steak, eggs, meat, and cheese. Claudette, Yeah, boy, again, a lot of questions. SVT, that's tachycardia. Same thing that I just mentioned. That was Jacques. It keeps coming back. Get that heart muscle strengthened. Okay? Tachycardia. And if you got a healthy heart, if they're telling you your heart is healthy, do what I recommend. CoQ10 in the form of ubiquinol, Navitol, high DHA. Janelle, her daughter, vitiligo. Oh yeah, well that's where you lose. It's an autoimmune where it attacks the melanin on your skin and you get the white patches. And no fun. Always start, Jeanette, with the gut because that's where it started. Leaky gut, fungal, almost invariably with vitiligo, and start with the gut. Start inside before you go to the outside. Don't feed the bears. Lay off the sugars. Broad spectrum probiotics. Bone broth. Knit the gut. Okay? Thanks, Janelle. Okay, this was one of your followers, Dr. Martin. Can you explain this? Someone posted, okay, from a Dr. Michael Richmond, a double board certified cardiothoracic surgeon. Today's video explained why most people don't need to combine K2 with their vitamin D. I got to listen to it, Joanne. I didn't hear the whole thing. I didn't hear any of it. I'm just taking, I didn't see it on our site. I don't agree with him. I've been around a long time and look, at least I think he's sane to take vitamin D. If he is, good for him. Okay? He's saying don't take K2 with it. Is he thinking K1? Blood thinner? K2 is different. God gave you K2. Why? To take calcium and put it in its proper place. And if you look at K2 with calcium, you're looking at eggs, meat, and cheese. It's in nature. God gave it to us. Calcium with K2. The reason we love K2 with vitamin D is vitamin D helps you to absorb calcium. The K2 puts the calcium where it belongs, in your teeth and in your bones, not in your blood vessels. So I don't know this guy. He sounds very smart, but I don't agree with him. Okay? But again, I didn't hear the whole thing. If I can find it, I'll look it up. But I disagree. You need K2. I want you to eat your K2. Okay? I do. Eggs, meat, and cheese. Eggs, meat, and cheese. You get calcium and K2. Then the calcium gets to its proper destination. And it's the same thing when you're taking vitamin D as a supplement. Take it with K2. Especially the MK7. Because it's just tells you where to go. It tells calcium where to park. We don't park in the bloodstream. You and sugar don't belong there. Okay, I like that. Okay, guys. I got rid of all the questions, I think. Somebody asked another question, I think. Okay. Anyway, if I see another one. Yeah, I think I got it. Okay. Love you guys. Talk to you soon.